I'm Chris Somerville, and I'm the CEO of the Schizophrenia Society of Canada. Schizophrenia, one of the most misunderstood mental illnesses of our time, and perhaps for all times, is actually a manifestation of psychosis. And to understand psychosis is that it interferes with one's ability to distinguish between what is real and what is not real. So we often might say that a person is in a state of unreality or having a psychotic episode, which is characterized by two main features. Number one, experiencing hallucinations, dealing with the five senses, and the most classic one is hearing voices that aren't real, but they are real in the mind and brain of the individual. The other feature of schizophrenia would be delusions, and delusions are simply fixed thoughts that have no basis in reality. That could be paranoia, that one's house is bugged by the RCMP, or one is hearing messages from God. There are also negative symptoms in terms of inability to socialize with people, sometimes difficulty communicating, choosing their words, affecting executive skills, sometimes accompanied also by depression and some cognitive challenges as well. So that's basically what schizophrenia is. If you're going to have schizophrenia, this is the best day to have it. Now that might sound kind of weird, but we know more about mental illness and schizophrenia than we ever have before. And so we know what helps people to be able to avoid significant schizophrenia by early intervention, early identification, and early treatment. And even if a person does go on to develop schizophrenia, there are a range of treatment modalities that help people in the recovery process, ranging from medication to talk therapies like cognitive behavioral therapy, to family psychosocial education. There's a range of psychiatric rehabilitation skills that can help the person to recover. So I think this is a hopeful time. Hope changes everything, but the challenges are that in our present mental health system, it tends to be symptom reduction focused. It should be focused on quality of life and helping people to achieve recovery. Also, shortage of psychiatrists, lack of community supports and services. Those things are very challenging. And one of the reasons for relapse is because that there are not the psychosocial approaches or community supports and services available for the people who need them. Example, if trauma is not resolved, then that unresolved stress, or continuing stress rather, can trigger relapse. So the reality is we could do a whole lot better, and we must do a whole lot better in terms of early intervention, early treatment, and providing a range of treatments and supports and services so that people can actually, I'll use the phrase, beat schizophrenia. You probably know someone who lives with schizophrenia or psychosis. You just don't know about it because it's difficult to come out of the closet due to the stigma. But approximately 370,000 Canadians live with some form of schizophrenia, mild, moderate, or severe. In fact, 3% of the population lives with psychosis. And it is quite high in the population. In terms of 1 in 100 will develop some form of schizophrenia. And it is important that we make it safe for people to be able to disclose, to be able to talk about it, and that they are not oppressed by the stigma. In fact, when I do advocacy around improving mental health services in Canada, I typically address it from a social justice perspective, not just a health issue. Because being one of the wealthiest countries in the world and knowing as much as we do about what helps people with mental illnesses like schizophrenia to get better and to even recover, and not to provide those treatment modalities, community supports and services, that's plainly a social injustice. And we can do better than that as Canadians. And so we have to have a kind approach, indeed, might I say, a loving approach, to be in an inclusive society that embraces people with lived experiences of psychosis and schizophrenia and debunk the myths that are out there. Medication is an important issue, while it can be controversial in light of the fact that some medications create significant side effects. Medication plays a critical role in terms of reducing the symptoms of schizophrenia. But it's more than medication. People also perhaps may need to address unresolved trauma, stress issues in their life, learn about stress management. Family education is very important, and providing the social supports. So people living with a mental illness, or people who have been diagnosed with a mental illness, are encouraged to work with their doctor in finding a medication that fits for them with the least amount of side effects. There is a lot of discussion about recovery today, and there's also a lot of confusion about it. First of all, each person must define what recovery means to them. Secondly, recovery is not linear. Recovery doesn't necessarily, it does not, in fact, mean cure, although people can go into remission and can go years without symptoms. Recovery is personal, but I want to be careful that we understand that it's not just a personal, optimistic, motivationally challenged journey. Recovery must include social inclusion, whether we call that integration back into society. So true recovery must include addressing stigma, social prejudice, and discrimination, and receiving people as part of the community and honoring them in their strengths and their hopes and their dreams and their goals. That's real recovery. One of the exciting developments around mental illness, and specifically psychosis and schizophrenia, has been the development of early psychosis clinics, or first episode interventions, because we now know, scientists have discovered, that the earlier you identify that a person is struggling with psychosis, and the earlier you intervene, and the earlier the person starts receiving various treatments, then the less likely they are to develop full-blown schizophrenia. People who experience mental illness can also experience substance misuse and abuse problems. In fact, up to 75% of people with an enduring mental illness will at some point use substances such as alcohol and cannabis. Talking about cannabis, we know that it can affect the developing brain, and that's our concern at the Schizophrenia Society of Canada, as well as many organizations who work with people with mental illness. The brain is still developing until age 25 approximately, and the effects of cannabis can have a more devastating effect on that developing brain in terms of interrupting brain development, creating depression, anxiety, suicidal ideation, and also there's a greater risk of developing psychosis through the use of cannabis, especially if there's a history of mental illness and mental health problems in the family. The risk increases significantly. So what we have to do is to provide the education, the information to young people and families so that they can make what's called informed decisions, to be informed well enough in terms of making a decision that's in the best interest of their own health and their own mental health and wellness. I'm often asked what families can do to help their loved ones, and what I encourage families to do is, first of all, learn all you can about schizophrenia, and also to talk to someone who lives with schizophrenia and another family member, and for someone who's in recovery, because families worry a great deal in terms of, will my son get better? Will my daughter be able to marry? will my child be able to function again in life? Can life go on? So talking with people who are in recovery and having recovery-oriented service providers around you can foster that hope. Also, joining a family support group and receiving what we call psychosocial education can help you not only in coping skills, but also how to address concerns that might arise in the family in terms of communication skills with the person living with schizophrenia. And I also encourage family members not to interpret everything about their loved one as being schizophrenia. That would be very unfortunate for any family to do that, because that individual still has personality, still has hopes and dreams, and can struggle with other life issues, obviously, not alone schizophrenia. So a family, I think, has to be recovery-oriented, and that is to look at the strengths of the individual, be positive in terms of hope, and learn the skills as family members that do promote hope and meaning and purpose and recovery. For those who are interested in learning more about psychosis and schizophrenia, you can go to the website of the Schizophrenia Society of Canada, and we have some links, various links to schizophrenia and psychosis, to substance use and cannabis use, how to be an effective advocate. The Schizophrenia Societies across Canada do provide peer support and support groups for individuals living with psychosis and schizophrenia, as well as support groups and family education for families and friends. And then there are other organizations as well that address the issue of schizophrenia and recovery. There's a lot out there, and a lot of tools on social media, a lot of e-mental health, as we call it, the internet and technologies that can assist in a better understanding of schizophrenia, but also learning the skills if you are a person with lived experience or a family member, learning the skills that will promote hope and recovery. Well, I want to encourage you as you listen to this video and the wonderful stories that recovery is possible, that people can get better. Hope changes everything. And we as a society, we must not close the door to hope. And we have to endeavor to do all that we can and all that we know to provide the various treatments and services and support so that people can go on and live meaningful lives. Schizophrenia does not have to be a hopeless case. And as we continue to change society's attitudes to seeing persons with hopes and dreams rather than just a label and an illness, we therefore can continue to build a mental health system that's recovery-oriented, leading to transformation of not only the mental health system, but positive transformation for people living with schizophrenia and their families.